Are permanent and semi-permanent fillers good options for facial volume?
People often ask for permanent solutions for issues like facial volume deficit related to genetics or facial volume loss due to aging. It's natural to want something that will last and not require periodic maintenance. It is important to know the potential adverse effects of semi-permanent and permanent fillers and the higher risk involved with using them in comparison to hyaluronic acid fillers, which I use routinely in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. In my practice, I perform comprehensive treatments for facial aging, which include facelift surgery, eyelid surgery, and facial implants, to specialized techniques for injectable filler placement and the use of lasers and radiofrequency technology. My approach is characterized by a natural aesthetic style. I select procedures for my patients based on meeting of specific criteria, including safety, predictability, and minimal to no recovery time. When it comes to permanent procedures, I often say that most patients want something permanent until they deal with the problems from so-called permanent solutions. Procedures such as facial implants are considered to be permanent. However, it's important to remember that your face is not permanent. When you're younger, facial dimensions can fluctuate with changes in weight. As you age, facial volume changes from diminishing bone, muscle, fat, and soft tissue. Changes in bone volume make the most significant impact as the bone structure provides the foundation for the whole face. So even if a facial implant itself is permanent, as bone volume changes with aging, a facial implant will be affected by the changes in bone structure. While facial implants can be surgically removed and replaced as the face changes, semi-permanent and permanent fillers are not in any way comparable in terms of the ease of removal. If surgery is required to remove semi-permanent or permanent fillers, it's typically not possible to remove all of the material. These materials can move in deeper areas so that many fragments of material, it becomes too risky to try to remove these fragments because of the risk to nerves, which can cause facial paralysis. Unlike hyaluronic acid, which exists naturally in the body and is therefore safely metabolized by the body, semi-permanent and permanent fillers are designed to be resistant to any of the body's natural metabolic processes. It is possible to get what's called a foreign body reaction to semi-permanent and permanent fillers. The result can be a formation of disfiguring nodules which require surgical removal. This is typically associated with the additional loss of normal skin and additional soft tissue. Infections are a possibility with any filler treatment or implant. Bacteria from the skin surface can enter the skin when the filler is placed, resulting in a type of infection called biofilm. When any infection occurs with an implant, in almost every case, the implant is removed. In the case of a hyaluronic acid filler, the filler can be dissolved with an enzyme called hyaluronidase, which eliminates the site where the bacteria takes hold. With semi-permanent or permanent fillers, dissolving is not an option, and surgical removal becomes the only option. Unfortunately, when bacteria create a biofilm type of infection, even after extensive surgery with maximal removal of material, recurrent infections can continue to occur. In the spirit of providing my patients with safety, predictability, and if needed, reversibility, I recommend hyaluronic acid fillers for volume correction. Hyaluronic acid fillers come in various thicknesses and viscosities which are suitable for different areas of the face. For the cheeks, jawline, and chin, I routinely use hyaluronic acid fillers like Juvederm Ultra Plus and Juvederm Voluma. These thicker fillers can last 1 to 2 years and are safely metabolized by the body. They are also completely reversible and can be dissolved without surgery using the enzyme hyaluronidase. I place these fillers in the cheeks using a special technique called structural volumizing, which I'm able to place fillers deeper at the bone level under the muscles so the fillers don't spread and look soft and doughy. This deeper placement gives the face a much more solid, defined, and contoured structure as compared to traditional filler placement in the soft tissue layer of the cheeks, which can look puffy as the filler spreads out. For the lips, upper and lower eyelids, I use softer fillers like Restylane L, Restylane Silk, Juvederm, Juvederm Volbella. I use specialized techniques for placement such as the use of blunt cannulas through limited entry points for the lips. This makes the procedure more comfortable with a low risk for bruising and minimal swelling. As an eyelid surgery specialist, I routinely use cannulas and soft hyaluronic acid fillers to treat areas such as the tear trough and camouflage minimal puffy under eye bags. These softer fillers can last 6 months to a year. Since all of these fillers are made of hyaluronic acid, a naturally occurring substance in the body, they are all safely metabolized with time. There are other facial fillers that are not permanent but have some disadvantages in my opinion. For example, poly-l-lactic acid, which is used in the material called Sculptra, is a material that triggers a metabolic response to create volume. I previously used Sculptra before the introduction of the newer hyaluronic acid fillers. Each patient responded to poly-l-lactic acid differently, making outcomes less predictable. Another material I used to use is Radiesse. Radiesse is made up of a material called calcium hydroxyapatite, which is similar to bone. The calcium hydroxyapatite is in the form of tiny spheres which are suspended in a gel medium. The drawback to Radiesse is that the material is not reversible or fully removable. Despite having a substance similar to bone, the effects of Radiesse typically does not last as long as a thicker hyaluronic acid filler like Juvederm Voluma. In consultation, I find that once people understand that the natural anatomic features of the face are not permanent and that the facial foundation changes with time, then semi-permanent or permanent fillers are not optimal. Safety and predictability are extremely important when it comes to any filler treatment. While hyaluronic acid fillers are not permanent, they can be placed predictably and they can last a long time. They're safe to use and they are easily reversible. I hope you found this information helpful. Thank you for your question.